Good afternoon and welcome to my professional development plan. My name is Sarah Hurd and I am a third year nursing student at JCU. I am currently in the midst of finishing my final placement. The end is near, however this will only be the end of a small chapter in my nursing story. Nursing is a career where you will never stop learning and requires a commitment to lifelong learning. Please join me for this presentation where I will reflect on my experiences and highlight strategies for continuing professional development into my graduate year and a plan for the next 5 years. Throughout my nursing degree, I have had the opportunity to attend several clinical placements. These clinical placements have exposed me to a wide variety of clinical settings, allowing me to develop diverse skills and gain comprehensive experience. As a first-year student, I attended Townsville University Hospital, where I was placed on the Surgical 3 ward. This ward was focused on neurological patients, ENT, and plastics. It was on this placement I gained a lot of experience around neurological observations, neurovascular observations, and I was also exposed to devices such as surgical drains and tracheostomies. This being my first clinical experience was really beneficial in gaining an understanding of basic observations and their importance, and definitely started my nursing degree on the right foot. My second clinical placement was at the doctor's clinic, where I gained exposure to small procedures, wound care, and injections. This placement was very beneficial as I was able to gain lots of practice with injections and improve my needle dexterity. There was lots of wound care involved with this placement, with chronic wounds requiring patients to present every second day or so for dressings. This allowed me to gain lots of wound dressing practice as well as build rapport with these frequent patients, allowing me to build therapeutic relationships. My Atherton placement also offered lots of learning, being a rural hospital and being rotated throughout the whole facility. I was exposed to surgical wards, medical wards, dialysis, theatre, and the emergency department. This was a jam-packed placement, but so valuable. I was able to practice so much and really develop my professional communication and documentation. My time on the orthopedics ward at the private hospital was also a rich learning environment. I was able to gain an understanding of a patient's experience as I was able to follow patients through from their time of being admitted into theatre, back to the ward, and then being discharged. I was able to develop my strength around my neurological and neurovascular factors and post-op routines. My final placement that I am currently close to finishing has been my favourite clinical placement to date. The pediatric setting is completely different to anything I have been exposed to throughout my university and clinical placements. There is differences in every aspect of the nursing role. This placement has allowed me to cement that I want to be a pediatric nurse in the future. Whether I am successful in getting a graduate position in pediatrics or having to go through a transition program in the future, I would like to end up as a pediatric nurse. With my pediatric placement, I definitely struggled at first to get my head around the differences between children and adult nursing, especially learning differences in pediatric medications such as being weight-based and only using PARP medications. Also, having to develop my communication with children and their families and having a family-based approach to providing nursing care and not just the patient. Identifying a knowledge gap is a tricky question to answer. Reflecting on my experiences, I think there will always be some form of knowledge gap throughout my nursing career. There will always be the need to have to develop knowledge, and I will never stop learning. There will never be a point where I don't need to learn or continue to develop my knowledge. With my current placement, I have identified I want to develop my knowledge around pediatric medications and pediatric communication and the family-centered approach. However, I believe there will always be a new way of doing certain things as research develops new methods and learning techniques, and that will be available throughout my career to improve current practices. This placement I have been exposed to lots of NGT and PEG tubes, and I identified I have a skill gap in accessing and caring for these as it was the first time I had seen them in a clinical setting. Also understanding all the different reasons someone may have one of these in situ, such as refeeding or decompression. I have also identified a need to improve my knowledge and skills around wound care, especially complex wounds involving drains, suction therapies, graft sites, and so on. I would also like to continue learning how to improve my therapeutic relationships and building that trust with patients and their families, and ensuring that the communication is clear and in a constructive way that patients can clearly understand. I have approached my SMART goals so that I ensure I align with both professional growth and safe and quality patient care. The NMBA standards align closely with the principles of CPD, which is essential for nurses to maintain and enhance their knowledge and skills. NMBA standards outline a nurse's responsibility to maintain practice, which encompasses a nurse's role of self-management and recognizing capability for practice. Standard 3.3 is particularly important, which states that as a nurse, you will use a lifelong approach for continuing professional development of self and others. My first SMART goal is that I will enhance my wound care skills in a clinical setting. I will assess my progress by my knowledge around different stages of wound healing and appropriate dressings and care techniques. I will achieve this by seeking mentorship, attending in-services, and reviewing latest research and guidelines. By improving my wound care knowledge, it will directly benefit patient outcomes and allow me to deliver high quality and safe care. I aim to improve my knowledge and skill set around this within my graduate year. As I said in my SMART goal, the first activity I would do to achieve this would be to attend relevant seminars, workshops, or in-services provided by the facility. And activity 2 would be reading up-to-date and relevant literature and research around wound care. My second SMART goal is I will enhance my NGT insertion and management skills by attending SimLabs and in-services, as well as reading up-to-date policies, procedures, and research. I aim to improve my confidence in inserting and caring for people with NGTs, ensuring appropriate patient care within my graduate year. I would achieve this goal firstly by going to self-directed learning using facility SimLabs, particularly to practice the skill. And secondly, I would undertake online CPD courses such as online sources such as OSMED, who provide online learning modules followed by quizzes. I'd also like to add that when looking to improve any areas of my practice throughout my graduate year, I would discuss these with my mentors, managers, and educators on how to improve and achieve these desired professional goals. Something I've seen on placement that's really positive is on multiple occasions educators have been present on the ward, touching base with staff and asking and offering learning and professional growth opportunities and helping to facilitate these. So I would make the most of the use of these services. My professional development plan for my nursing career in the next 5 years will focus heavily around the pediatric setting. As previously discussed, I am hoping to nurse in the specialty of a pediatric ward. My 5-year plan isn't rigid and can be modified depending on how things work out. I don't expect everything to flow smoothly, and there will probably be a point where my plan may need to be evaluated. Ideally, I would like to complete the 12-month graduate program in the pediatric setting. However, if not, I would like to work towards eventually working in the pediatric setting. So for this, I'm going to say I am not accepted into the pediatric grad year and I am in a normal ward. So during my graduate year, I would focus on just getting as much ward experience as possible and learning lots of skills and gaining as much knowledge as possible. Then in my second or third year, I would apply to a transition program. As per Queensland Children's Hospital, there is a transition to pediatric practice program available within Queensland Health. Following this, in my third or fourth year, I would like to begin a postgraduate degree on pediatric nursing. Continuing with these postgraduate studies into my 5th year with the aim of completing these by the end of my 5 years in nursing. There are many different education institutes that offer postgraduate nursing specialty studies in pediatrics. Griffith University and University of Tasmania are just 2 of many options that both offer 12-month full-time postgraduate degrees online. However the next 5 years play out, I'll be ready for my career plan to be adaptable, as everything doesn't always go to plan. As I get ready for my future career, I am both nervous and excited to see where nursing will take me. Thank you for taking the time to listen.